Us in the room. So make sure you're comfortable. Sit back and relax for a really great informative morning. Those of you that are on also, I'd like you to know that the Southeast PTTC is currently planning out our 5th year. And we'd love to hear from you in the chat. If there is a particular topic you would like for us to consider addressing through a webinar or some other means in our 5th year, which starts October 1, please put it in the chat and let us know, and we're going to save the chat.
Kristen, Taylor, are we recording?
We are recording? Good. All right, well, while we wait for more people to enter, I'm going to go on and get started with some of these slides, get through the housekeeping. So my name is Kristen Kidd, and I'm one of the coordinators at the Southeast Prevention Technology Transfer Center. And we are all here for today for part 2 of our annual workforce development series, focusing on principles of the environmental approach in prevention. So we can go on to the next slide. So this training is being recorded and it will be available on our website in just a few days. The training is 100% funded by SAMHSA, the Substance Abuse and Mental Health Services Administration. They fund the Southeast PTTC network. The views, policies, positions, and opinions that are being expressed by the speakers today do not necessarily represent those of SAMHSA or the Department of Health and Human Services.
I always feel like you're throwing us under the bus with that one.
I am throwing you under the bus. So please do check out on the bottom of your screen on the right, you'll see the little chat bubble. That's where you can communicate with us today, ask us questions, make comments. We are going to be encouraging you to participate in the chat, and we'll be asking you some pointed questions, and we want to hear your thoughts. When you respond, please make sure you check everyone. Sometimes it automatically goes to just panelists, but we want to make sure that everybody in the room today hears your thoughts and your sharing. So let's see, after the webinar, you're going to be sent to some evaluation questions. And from there, you have the option to participate in just a few more evaluation questions. Some we're really interested in knowing how this webinar is impacting your knowledge around the particular topic. Today it's environmental strategies. And then there are some more questions that SAMHSA is really interested in knowing about, really how you felt about the webinar and the information and how you might apply it to your work. After you participate in those, you automatically get sent where you can download your certificate of attendance that you can customize with your name. It's in a PDF that you customize. Sometimes it just shows up as downloaded in the bottom bar of your screen, but you don't have to wait for us to send it to you. If you participate in these evaluations, you automatically get it. And as it says here in the top right corner, all of our webinars are on our YouTube page. So go to YouTube and search under Southeast PTTC, and all the webinars that we've been doing will be available to you. You can download them, or you can just watch them. You can share them in your coalitions, either full webinars or snippets, but there's all kinds of topics that you'll find there. So do check that out. So as I've said, I'm with the Southeast PTTC. There are 10 TTCC networks around the nation, and then there are 3 special population centers. There's, of course, the Network Coordinating Office that is sort of our, our administrative support, runs the show. And then you've got the National American Indian and Alaska Native Center and the National Hispanic and Latino Center. So there are 3 particular networks. There's the Addiction TTTC, there's the Mental Health TTTC, and there is the Prevention Technology Transfer Center. Each region of the US, we're region 4, each region has an ATTC, an MHTTC, and a PTTC. We are all funded by SAMHSA, and we are your tax dollars at work. So go to your ATTC or MHTTC or us, the Prevention Technology Transfer Center, in your particular region. If you need resources, or you want to hear about a training, or you need some intensive technical assistance, we are all here for you. And of course, if you're also interested in particular populations like Native American or Latino community, go to those specific population networks as well, and they'll help you. So we're the Southeast. We serve 8 states here in the Southeast region, and there they are listed. We are housed at Wake Forest School of Medicine in Winston-Salem, North Carolina, where it's approaching 80 degrees and 100% humidity. They're under the direction of doctors Mark Wolfson and Kim Wagner. So I think that sums it up. So Taylor, I'm going to let you take it from here with the rest of the introduction, and then we'll start the show.
Thank you, Kristen. So my name is Taylor Steed, and I am also with the Southeast PTTC. And this slide just talks about affirming language and that words have power. Inclusive language is the recognition that words matter and that word choice can be used intentionally or unintentionally to include or exclude others. And using inclusive language communicates in a way that is respectful, and it really brings everyone into the conversation together. And so the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. And next, I am going to introduce our speakers. So the first is Carlton Hall, and Carlton is the president and CEO of Carlton Hall Consulting, LLC. Carlton has been providing intensive substance misuse prevention and community problem-solving services to the nation for the last 25 years. And currently, Carlton and the CHC team provide executive training and technical assistance support to the Southeast PTC, which is our region, Region 4. And the next presenter is Dorothy Cheney. And Dorothy is the founder of Wisconsin Community Health Alliance, which is an organization committed to supporting coalitions, agencies, and individuals to improve the health of their communities and the environment in which they live. Dorothy has also served on many state-level work groups and advisory committees in the state of Wisconsin. And for more than 20 years, Dorothy has worked with community-based coalitions to address the impact of substance use on youth and families. And our third presenter is Dave Chevelle. Dave has extensive experience in the substance abuse prevention field at the community, state, and federal levels as a community organizer, coalition director, trainer, and technical assistance provider, researcher, and state prevention manager. Dave currently works throughout the U.S. and internationally to provide training and technical assistance to increase the knowledge, capacity, and accountability of community anti-drug coalitions. So that's your 3 presenters right there. And with that, I am going to hand it over to Carlton.
Taylor, thank you so very much. And Kristen, thank you for setting us up so very, very well. We're looking forward to the conversation we're going to have today. And we want to start off by making sure that we're able to engage everyone in this conversation. Folks, we're going to be kind of asking you questions and making sure that we're checking in with you, but also wanting to hear from you, your thoughts, your comments, wanting to hear your insights as well. This is really a session that is designed for us to learn with each other. And I'm seeing in the chat already a number of you that are coming from a wide variety of locations. And so I'm excited about what it is that we're going to be able to do with each other today. And so if you don't mind, go ahead, put in that chat box your name, your community that you represent or serve, the organization that you might represent. And if you could think about this, as a way of getting us started, have you been involved with environmental strategies at all? And if so, just 1 or 2 words that might be able to represent that, and that'll allow us to engage. And I see you all kind of doing that, and so thank you so very, very, very much. We're going to be engaging with you throughout. I want to start off the conversation just kind of with a little bit of a uh, uh, and a thought that actually stems from my own personal experience. I have shared with Dave and with Dorothy and Kristen and Taylor the fact that I'm watching my grandchildren right now, and in fact, if you hear any banging in the background, that's just them and screaming that they want me to change the channel to Paw Patrol. So I'm trying to ignore them as best I can. But here's the thing that I learned and I discovered when I go to their homes, right? When I'm in their house, what I find is that even though I have a couple of degrees, I find that I can't navigate the stairs in their homes. And it's a crazy, crazy thing. I love my grandchildren, but when I want my snack, once I get downstairs, I find I can't open up the cabinets. I can't even call anyone because I can't figure out how to charge my phone and doggone it, I'm sorry, I'm over 50 and I don't mean to be rude or crude, but I think that there's just some places in the home that should never ever be restricted. And here's the point that I'm wanting to make here. In the context of this environment, who's the priority? Is it me? Who's the priority in the context of this environment? And if you wouldn't mind, go ahead and put that in the chat for me. Put that in the chat really quickly, and I'll wait a couple of seconds. Who's the priority here in the context of this environment? Is it me? Who else? And I see a number of you saying, yes, the children, the children, the children, the children, all of those kids. Exactly, exactly right. They are indeed, and they are precious. They are precious. But here's the point that I want to make here. Um, there is absolutely zero doubt who the priority is in this environment, right? And in a very real sense, for those of us that are working in the field of prevention, this to me is what prevention is truly about. Prevention is about identifying the most vulnerable in our population and identifying not only who's the most vulnerable, but where they are most vulnerable. In other words, where are those environments that place them at greatest risk? You know, like the top of the stairway for my infant or toddler grandchildren, right? That the top of the stairway represents an invisible vulnerability in the context of their environment that needs to be made obvious. And in prevention, we need to do that across the span, across the lifespan. Prevention should be obvious, is the point that we're wanting to make, just like taking and putting that gate at the top of the stairway. And partially, this is what it is that I'm sharing. And this is what it is that we are going to be discussing today with this remarkable team that I have the privilege of working with today, that's going to actually take most of the lead in leading us through this conversation. And so what we're going to do is we're going to describe what does it mean to look at our environment in very thoughtful, strategic ways as preventionists, and how can we describe what those environmental strategies are going to look like. We're going to look at what does it mean to produce change at the population level utilizing and employing environmental strategies, identifying what does it mean to be evidence-based if we're going to think about environmental strategies, and how we might be able to use the strategic prevention framework to help us identify where and how to implement those environmental strategies. Throughout this whole conversation, we're going to have opportunity to interact with each other via the chat so that we might be able to learn from each and every one of you as we're going through this conversation. And so we're going to start off. We've already started with some introductions and telling you the objective, but we're going to go into what is an environmental approach and then how to utilize the strategic prevention framework to actually think about how we select those environmental strategies and the components of an evidence base for environmental strategies. And we're going to talk then about what and how you might be able to apply this in the context of the work that you're doing in your own communities. So Taylor shared with us and expressed to us the importance of words. We're just simply trying to share with you that throughout the course of this training, we may be employing language that's sort of jargony, right? And so we might come up with those terms. Please, in the midst of this training, if there are words that we're utilizing, or if we get into too many of the acronyms and the like, just go ahead and stop us. You can share in the chat and say, hey, I didn't understand that, and we'll be able to make sure that we can provide clarification as we can. And so I want to start off with this a simple question, right? That I want to utilize. If your dog has fleas, what could you do to address your dog's fleas? Go ahead and put that in the chat. And this is in the context of understanding what does it mean to address something effectively. So if your dog has fleas, what might you be able to do? Put that in the chat for me, please. All right, treat it. Good. Treat it. Yeah. Get a collar. That's exactly right. Yes. A flea bath, shampoo, absolutely. A thorough bath. Use those products. Capstar. I have no idea what Capstar is, but obviously there's some really great products out there. Take it to a vet. You're exactly right. You could treat the dog and the puppy very, very well, absolutely, with all those products. But you can also treat the environment in which we place that puppy, right? And so if we only treated the dog, but we did not treat the environment in which that dog is housed, or he spends most of his or her time, would we be effective? And the answer, I think we can all agree, is probably not as effective. And so if we're going to be effective, we have to treat both the puppy, but also the environment in which that puppy comes into contact with those fleas. And that's really the impetus of this training that we're going to conduct today. And so with that, just a simple definition of environmental strategies as offered by the Substance Abuse and Mental Health Services Administration to get us to make sure that we're all on the same page. We're looking at those kind of efforts that are aimed at changing or influencing our community conditions, the norms and standards, those institutions and structures and systems that we are all governed by, those policies that contribute to substance misuse and its consequences. This is what we are talking about when we speak about environmental strategies. But in order to make that a bit more plain, I'm going to turn this over now to my great friend and one of the best instructors in the nation, Miss Dorothy Cheney is going to come up. And Dorothy, I'm going to stop sharing my screen so you can go ahead and get us started here. And I'm passing the baton to you.
Awesome. Thank you. Thank you, Carlton. I'm looking like I'm having a little bit of trouble bringing up my slides.
Okay.
So I'm going to see. There, are they up?
They are.
Perfect. Awesome. Wonderful. Thank you so much.
We did it.
Yes. I love WebEx. So what is an environmental approach? And I just have to give a shout out to Emily. She's a dog rescuer, so she loved that example. I love that example too. Can I just tell you though, Emily, that graphic that had a dog in a doghouse, my dogs have never been in a doghouse once. So, I'd have to be changing the environment on my bed because that's where they sleep. Welcome to our session, folks. And what is an environmental approach to prevention? So thank you for sharing in the chat box. We're going to ask you as we go through all of these slides to continue sharing. And I'm going to just also welcome Kristen, Dave, or Carlton to jump in at any time. These sessions become rich and meaningful when everybody contributes on the training team. And that also goes for the participants. So Dave, I'm going to ask you to help me monitor the chat box while I have the slides up as well. So when we're thinking about environmental approaches to prevention, it's always important for us to just really sort of name and frame what we're talking about when we're talking about prevention. And I love this graphic that came from my home state of Wisconsin. And it shows sort of, we often talk about the river story when we're talking about prevention. And we can see that there's an arrow, sort of a continuum all the way along this graphic. And we can see that there are people in the river, there are people on the bridge, and the people that are in the bridge, Carlton talked about vulnerable populations. That group is particularly vulnerable because they're about to walk into a place where there's a hole in the bridge. And so from a prevention standpoint, we want to make sure that we address fixing the bridge so that people don't fall in. So that's really what we're talking about, is we're going way upstream to fix the bridge. But it's also really important for us to understand that there are already people that are in the river, and we also need to make sure that we're addressing and taking care of those folks as well. And that's sort of how we look at the continuum of substance use prevention. But our wheelhouse is really, how do we fix the bridge? And you can see there, we could educate people not to walk on the bridge. That would be one great strategy. But you know what? If we fix the bridge, then you know what? That would be a great way to change the environment to prevent people from falling in.
And Dorothy, when you talk about walking upstream, I've never seen the example that Ruth from Michigan provided. She said, stop the dog from catching squirrels. And if you think about it, that's walking upstream to find out how the dog is getting the fleas in the first place. And so I love that, because we always say, when you've seen one community, what have you seen, Dorothy?
You've seen one community.
And so again, each community, each dog may be getting the fleas from different sources. We need to find out what those sources are as we're walking upstream. So thank you, Ruth, for that example.
That's a really good example. I just have to admit, I'm getting a little itchy as we're talking about all these fleas. But anyway, okay. So when we're thinking about it, we also need to look through the lens of the epidemiological triangle, the public health approach. And the public health approach really involves the agent, the host, and the environment. And so when we're looking at the agent, the host, and the environment, what we're looking at is the context where the agent and the host come into contact. And in the example that we've just been talking about, would be the agent would be the fleas, the host would be the dog, and the environment would be the context where they come into contact. And so when we're thinking about this, we've already talked about what we can do to address this situation. So I love, Ruth, you said that we could stop the dog from catching the fleas. We could take the dog to the vet. We can give him a bath. Those are all going to be strategies that are going to impact the dog. But then we can also look at the environment. Someone said we can mow the lawn, make sure that the grass is lower. That would be a great way to actually change the environment. And so it's a really important piece as we're thinking about environmental prevention, is that we understand that at the root of the strategies that we're working on is the public health approach, that we need to do strategies that are going to get the fleas off the dog, but we also need to mitigate the environment so that the dog doesn't get the fleas again. That's the public health approach. And it's important to understand that it's not just an either or, just environmental strategies or just working on the individual strategies, the dog, but it's a mix of both. And that's where we get effective prevention approaches that get us to population level or significant reductions in the problems that we're working to address. Now, here's another example. So in this one, let's think about it through the lens of the public health model. So in this one, cocaine is being sold at a neighborhood bar. What strategies can we do to address this situation? Think about the agent, which in this case is cocaine, the host, which would be the user that's buying the cocaine, and the environment is the bar, where the host and the agent come into context. And Dave, I'm going to ask you to read the chat box because I can't seem to find it as I'm sharing my screen.
Go ahead and place in the chat. What can you do in this situation, everyone?
Well, people are writing, Kimberly summed up the whole process, the overall aspect of helping people or the situation. That's the individual.
Oh, I love it.
The situation is the environment. Thank you, Kimberly.
Love it. Love it.
And we always say that again, we do prevention where the agent, the host, and the environment come together. And so that's why, again, when we know when and where something's happening, like in this case, it's at the neighborhood bar, then we can do strategies, both individual and environmental, to address the situation at that time and at that location.
So Dave, I'm going to think, is there any, if there's nothing in the chat, oh, we're going to see Charlotte says, place more law enforcement in the area. That's a fantastic strategy. That's going to address the environment. That's going to address the environments. Absolutely. Great.
Xavier is saying,
Where it is coming from and the who's providing it. So how's it getting to the bar? Who's bringing it to the bar? I love it.
We're going to educate the public. So that's going to be an individual strategy. We're going to do education and awareness, but we're also going to do enhanced enforcement. We're also going to identify where the substances are coming from. Was the next one in the chat box there?
Something will need to be done at the bar itself to present this. What it looks like, I'm unsure, but some sort of environmental law enforcement is a good idea. That reminds me, Dorothy and I did some work in North Dakota, and it was a small town, and there's just 2 bars, and they actually put live feeds from the bars, cameras from the bars to the police station. And that served multiple benefits. It not only, again, addressed if there was illegal activity occurring, but if something happened, the bar felt safer because they knew the police potentially were watching what was going on. So that had a win-win. That was an environmental strategy because it impacted everybody in that bar that was viewed by the police, the law enforcement under via the camera. So again, when we know what the situation is, and I like Jen said, we don't know what it looks like. Again, we don't know where the cocaine use is occurring in the bar. Is it in the bathrooms? Is it on the, at the table? So again, we need to understand that environment to identify what we can do about it.
Love it. Great mix of both individual and environmental strategies here. All right. Well, I'm almost tired of talking about COVID, but this is a great example of the public health model. So if we say that there's a new COVID variant that's now prevalent in our community, what would be some strategies that we would use to address this?
Again, and I'm thinking of, again, this is the benefit of evidence-based strategies. There's a lot of approaches. A lot of people have ideas. Some communities are going to adopt some communities are going to adopt others. That's why, again, it's up to the individual communities to be deciding what's best for our community.
Love it. So Kate said contact tracing, education, absolutely. We may want to, mask mandates would be brought back. So that would be changed. That would be a policy that would be impacting individuals, but it would be impacting all of us. It would be changing our environment. So we could either encourage or mandate mask wearing. We could educate people about the new variant.
Have you been into a store lately where they still have the circles on the ground where they want you to stand 6 feet apart?
Absolutely. Yes.
Go back to that.
That's right. We would implement social distancing again. So we would be educating the public. We would also be changing our environment. And that's really what the public health model leads us to do, is just to be very strategic and intentional and about identifying the host. In this case would be all of us. The agent in this case is COVID, and the environment is just everywhere where we could come into contact with it. And so looking through the lens of the public health model, it really helps guide us to not just strategies, but the right strategies and enough strategies that we're going to change individual behaviors. So let me ask you this. Why is the public health model so important to our work in prevention?
I know.
Dave, I'm going to get you to read the chat box, or if you know, and you're just, needing to answer, feel free to chime in.
Well, again, Kimberly's talking about educate on the facts. Look what's going on with monkeypox. I've seen misinformation everywhere. So part of our role as preventionists is to make sure that people have, and Ali's talking about some finite evidence and research. That's our role as preventionists, is to make sure that whatever the local condition is, whatever the environment, the situation where the agent, the host and the environment are coming together, we can provide actual factual research-based information. That's our role to do that. And again, Kate's talking about, and we'll talk about this, using the strategic prevention framework. If we use a process to do this, we'll be able to have an understanding, do that assessment of what is the environment, do that planning around what strategies can impact that environment.
And Dave, I love that Nicole said in the chat box that we're addressing the larger population. And that's exactly what we're trying to do by using the public health model, is to not just change one individual or another individual, but to change the behaviors and the conditions of an entire community or entire population. That's why the public health model really guides our work in effective prevention. And with that, Dave, I'm going to stop sharing and I'm going to turn it over to you.
And I think a great transition is Dawn is mentioning the public health model as a guide provides fidelity when used in our community. And also, who is that Ruth talked about, we want to recognize our role in impacting an issue. We don't have to be the people who are changing all the environments. We just have to bring those environments to people's attention in our community. And as a community, we can talk about collective impact. As a community, we can impact that environment. Excellent, excellent. And now it's your turn, Dorothy. You can keep me informed of what's happening in the chat box. And I'm going to share my screen if I may. And can I see a, oops, share my application, okay.
You're good.
I see a thumbs up, okay, good. So we're going to take a little bit deeper dive. You've already started talking about it, is what are individual, what are environmental strategies? And we can't reinforce enough what Dorothy has said around we do both. We don't just do one or the other. It's not an either or. We want to do both individual and environmental strategies. And so another way of looking at this, another example is if we were in a room and we could see everybody, I would ask the question, how many of you drive a car? You can raise your hand in your office. Carlson's raising his hand. How many of you typically know the speed limit when you drive your car? And then how many of you, and again, we won't take pictures. How many of you have exceeded the speed limit when you're still driving the car, even though you know what the speed limit is? Carlton's turning his camera off, so he's not going to answer that. We can't hold him accountable. And then I would ask, how many of you have ever received a ticket? So you get where I'm going with this. A lot of times we have the information. People have the information they need, and it takes more than just information to change behaviors. So again, Carlton, maybe he has speed. And
Jen and I are feeling targeted by these questions.
okay.
That's all I'm saying.
But the point is, we know the speed limit, and so what changes our driving habits? A lot of times it's environmental strategy. So when you think about it, and you can put in the chat box if you want, what changes you? Well, again, we all know the speed limit, we all drive, we all know where the brake is on our car. What changes our behavior when we're speeding? And you can put it in the chat box if you want.
Tickets and fines, police present.
Okay, what's when we see a police officer, cops, if any of you have speed bumps or speed humps in your community, I would love to hear from those of you who are saying music, how that changes our speed. Accidents, right? When we see an accident, or if you've ever had to gone to traffic school after getting a ticket, they show you the results of speeding. They show you the results. Fines, penalties, dangers of wrecks. These are all, again, when you know your insurance is going to go up. Traffic circles. So traffic circles are a great way to change people's behavior. It's a physical change to the environment. I don't know what we can do about crazy other drivers, but that's an individual strategy to be able to be aware of other drivers, drive defensively. So this
Dave, I love what Melissa said. Melissa said what changes her driving behaviors are having her children with her.
Yeah.
Yes.
I don't know if that's individual or environmental strategy, but again,
but it's a good strategy nonetheless.
These are all strategies, and I live in Portland, Oregon. If you're ever driving into the Portland airport, they literally park a police car with lights on, but it's empty throughout the day, just so people will slow down at that stage in the approach to the airport, because that's what people see. So again, information alone doesn't necessarily change behavior. It's a combination of these individual and environmental strategies. Excellent, excellent. So again, we've talked about a lot of this, but a lot of our efforts with these trainings is to, I'll say, empower you to go out and share with others. So we're going to provide some language around you. And this is what we've talked about. Individual strategies target individuals or groups of individuals. If we provide a class to all fifth graders, a prevention curriculum, we're giving them individual strategies. So it's not just targeted at one person. It can be targeted at focused on a group of people that intends to build the knowledge, attitude, and skills of people within that population of focus. So within that group, we're teaching them, we're giving them information, we're giving them skills that they need. And so what do we know about individual strategies, they tend to focus on single strategies, meaning in school, there's a very specific intent and content in their curriculum. If it's information about traffic signs and speed, it's very specific to what we're trying to impact, provide to individuals or groups. And we can provide a greater dosage, meaning if we have a class, many of you may have heard of Life Skills or Project Northland. These are all where there's multiple classes where people have time to learn the skills and practice the skills, or parenting classes. We'll see those where we can provide more opportunity because we're focusing on individuals so they can learn those skills and learn that knowledge that'll impact their attitudes and behaviors. So again, I'll just ask if there are any questions about individual strategies, or Carlton, Dorothy, you want to add anything about individual strategies?
I would only say that individual strategies are important as well. And so as we have this conversation about environmental strategies and the need for environmental strategies, I want to just emphasize that individual strategies are important. They serve a purpose. We require them, but individual strategies by themselves, as Dave and Dorothy have been mentioning, are not sufficient. And we tend to lean almost exclusively on individual strategies in many of our communities. So I just wanted to just kind of underscore that point.
It's interesting, there are some funders fund individual strategies, some funders fund only environmental, some funders fund both. So that's why, again, we talk about and we'll talk later on today about a comprehensive set of strategy that can be used to address any particular situation in our community. And so these are just some examples and the domains or setting in which it occurs. And what's nice about this is we're hitting information, we're providing information to youth, to their parents, and for those youth that may have the opportunity, there's also a lot of mentoring programs where we're able to provide those individual attention to young people. So again, these are all intended to address those skills, the knowledge, the attitudes of individuals, which will then impact their behaviors. Then we can look at environmental strategies, which, as Carlton described, address the policies, procedures, systems, norms, expectations, regulations, conditions, and enforcement in a shared community environment. So when you think about that list, policies, procedures, systems, norms, regulations, there's a lot of ways we can put environmental strategies into place. It doesn't have to be passing a new law. It can be putting a speed bump, or someone mentioned having a traffic circle. That's an environmental strategy because it changes that shared community environment. So when you think about it, environmental strategies reach the greater community. That speed bump, that traffic circle applies to everybody that drives through there. When we change a law, we put a law in place, that impacts everybody that's under jurisdiction of the law. When we provide training for law enforcement on whether it's party patrol or conducting compliance checks, that's impacting everybody because they're going to apply their knowledge and skills in every situation that's appropriate. So again, it doesn't have to be laws. It can be a range of strategies that we use to change that place where the agent, the host, and the environment come together. And so again, they're longer in duration. The beauty of environmental strategies, once we put that speed bump in, it's always there. I don't know if you remember, there was I think it was a Geico commercial where it showed a race car driver was trying to take away a speed bump because it was slowing him down. So again, these speed bumps stay in place, and the traffic circles are there. The laws are in place as long as they're enforced. They're there for the long time, so they not only affect the whole community, they're there for, again, as long as they're in place. And finally, we can show more rapid results. If I put in the speed bump, that's going to slow down my behavior that second. If we start doing compliance checks, that's going to start that behavior immediately because vendors don't want to be caught selling to minors. So that's the beauty of putting these in place. They can have that immediate impact. Whereas, again, nothing wrong with individual strategies, but a class for fifth graders, and we need to reinforce that as the fifth graders get older. That's going to take a bit longer time to see the impact of less substance use among those fifth graders as they age.
Dave,
so that's the beauty of environmental strategies.
Dave, sometimes we utilize the analogy or the metaphor of a fraction and those of us who have worked with fractions, back in middle school, and talking about the numerator and the denominator. And a lot of times, the way we can think about this is that a lot of individual strategies are really like addressing the numerator in that fraction. But if you're going to address the denominator, you're going to need environmental strategies. And a lot of what it is that we have to focus on in prevention is what is it that we're doing to focus on the denominator of our community population.
And it's a really important point that you guys are making is that we need to look at the denominator and to reach the broader community. I also want to just say we can sometimes define the community, like a community could be defined as a school.
Yeah.
So there could be environmental policies in schools or within organizations. So part of our work is also to define that community. So we're certainly looking at the broader community. But there's lots of environmental strategies that we can see in schools and in organizations as well.
And Dorothy and Carlton, what you're talking about is the need and why we have coalitions. If you're working on a coalition, is because an organization itself can't change a policy. Again, in school policy, if we're trying to change law enforcement or how the administrative fines is in place, or put a county ordinance or a city ordinance in place, it takes a range of organizations and individuals to do that. That's the beauty, the power of the coalition. That's the beauty, the power of a task force, where different individuals and organizations come together to impact these individual and environmental strategies. And what you're looking at here are examples of different environmental strategies. Again, they're all aimed at a location and how we're going to impact the location. The first one, if we're putting in policies at community events, say you have a rodeo or a county fair, by roping off where the drinking area is, by making people take IDs at the entrance to it, by training the servers to not overserve and to check IDs. That's going to be policy at that rodeo, at that event. So as Dorothy said, it's not going to take a county ordinance to change what happens at the county fair. That's just a policy the county fair would adopt. Again, and you can start to see each of these examples is trying to address a particular situation where the agent, the host, and the environment come together, whether it's at school or city events, or it's in the home even, drug take-back programs, or removing the availability of prescription drugs from the home. And the last two, the public awareness campaigns and alcohol warning signs and posters, if you notice there's an asterisk by those, and we just are reflecting the way different organizations, some states, some funders consider broad public awareness campaigns where you're getting the word out to everybody in a universal manner. They've considered those environmental strategies, so they will, if they're only funding environmental strategies, they will fund them. Others list environmental strategies such as public awareness, putting up billboards or sending out flyers or warning signs. Those are individual strategies because you're trying to give knowledge and skills to individuals. The point is we need to do both, environmental and individual. And so I'll ask the same question we asked before. Any questions or comments about environmental strategies?
What thoughts or questions do you have? Have you guys had experience utilizing environmental strategies? Put that in the chat or let us know.
Okay. Well, while you're doing that, there's just or to reiterate what we've mentioned, there are two ways of looking at environmental strategies when we start talking about those policies, those ordinances, those laws. The first are what we call big P policies. And this is where an elected body such as a city council, a county council, a school board that's elected needs to adopt a change to their policy. And so this is important. It may be a social host ordinance, or we're going to amend our school academic drug policy to include vaping and include other prescription drugs. We're going to put up a drug-free zone in our park or in our city. Those require the elected body to be able to adopt it. And that's important because then lobbying comes into effect, and we want to be aware as an organization of lobbying rules. We don't want to violate any rules. There are ways that we can advocate for these big P policies. So we want to acknowledge that there are these types of policies, and there are also little P policies. These are those changes to procedures, changes to how laws are enforced, to how we do our training. And so when you think about it, if a social host ordinance is already in place, we don't need the big P policy. but we may need the little p policy so we can have our police trained or our community trained in doing party patrols. Or we're going to put up have a texting tip line, and we need policies around how the texting tip line will go into place. Those are
Dave,
small p policies. Yes.
So there's a lot of great chat going on.
Yeah,
So
yeah.
there's folks that were sharing, so Dana worked on compliance checks, both alcohol and tobacco. Larissa was talking about a social host ordinance, a great environmental strategy. Anastasia said that she has not yet started working on environmental strategies, but I'm really excited. In the next few months, they're going to be working on a new smoke-free policy. Lots of great environmental strategies. And then I love this one, Mitchell. We got onto the board of the community center. This is a great one, to change the policy of when alcohol can be served while renting the community center. If rented for birthday parties, celebrations for those under 21, no alcohol can be present. Love it.
Excellent.
And again, Jen's writing now, I realize most of my prevention strategies have been individual based with education. And that's great. We need to do that. That's our role as prevention providers. No one else is doing that. But how can we bring other partners to the table to address that broader community environment? And shout out to Costella, I know, who has been a funder. Thank you for your support of how we're explaining this. So thank you.
So I love what Jen said too. I want to read this because this is a really important one. Jen says, now I realize most of my prevention strategies have been more individual based with education. I want to learn more ways I can try to do this from an environmental perspective. Seems to be more difficult for sure, especially as a team of one. And so I just want to say, individual strategies are a necessary ingredient, but it's not going to bake the cake. Environmental strategies, a necessary ingredient, but it's not going to bake the cake. Only when the ingredients come together are we going to bake that cake. So individual strategies are very important, but you can't do it all, Jen. That's why community coalitions, partnerships, collaborations are really considered best practice so that you can bring together people who also care about these issues and together collectively can start working on those environmental strategies. But I love that. I love that comment. Mitchell also helped plan a community jazz festival by ensuring that there was a separate area for the adult beer area and the youth were away from the alcohol. I love it. And Mitchell gave some great advice. Get involved in the planning of any community festival. Some community organizing going on over here in the chat box. So love it.
Make you Costella hungry. No, but and the other piece here is we're providing examples. We've talked about river stories. We've talked about fleas. We've talked about cake baking now. We've talked about speeding. As preventionists, this is our way to help make the case to the community by using these types of examples so they understand what is the difference in the need for both individual and environmental. So we stole these examples. We don't steal, we borrow heavily these examples, and we encourage you to borrow heavily and use your own examples as you're going out into the community and engaging your community members in conversations about changing behavior. Good, good. So again, just to have our conversation here, what we're having, what other examples, if you think now of, just think of any community-wide behavior change. Think about seatbelts. We've changed behavior around seatbelts by providing information, click it or ticket. And then we've also had enforcement. You can get pulled over if you don't have your seatbelt on. That's individual and environmental strategies. And so we'd love to share your examples. Jen's just formed a coalition, a county commissioner, Georgia State Patrol Officer, and myself. I'm hoping this will lead to more partnerships. And what the beauty of this, as you start to do, and we'll talk about the strategic prevention framework in just a bit, as you start to do that assessment and you start to identify those conditions where the agent, the host, and the environment come together, then you can also start to identify who are the partners, who's impacted by that,
right?
Who can change that, who are the partners that we can bring to the table. And if you're working with the sheriff, who's Jen working with, the county commission, the state patrol, you've got some influencers there who can bring people to the table. So you've got a real good start to a coalition. Your challenge is just do the assessment and find out what's happening in our community.
Dave, I'm going to highlight a comment that Melissa made because I think this is a really important one. Melissa said, struggling with the enforcement element. And I think it's important to speak to that. We've talked about the fact that when we're looking at environmental strategies, it's really collaborative. That's why coalitions or partnerships or task force come together collectively. And sometimes we need to build our capacity. So I think it's important to understand that, we have to bring all those pieces into place in order for us to have effective environmental strategies. And sometimes it takes a minute to actually build the capacity and develop those relationships. So when you're thinking about enforcement, Melissa, think about who is the person that would be enforcing whatever the strategy is, whether it's school policy or whether it's a community level policy. Is it the local police department or the sheriff? And start to really use your coalition members to help, connect with that enforcement agency. And sometimes we need to build their readiness to understand that there is an issue that needs to be addressed in the environment, like enforcement, and we can use our data to tell that story often. We'll talk about that a little bit more when we talk about the strategic prevention framework.
And I love it, Ruth. And Ruth, I'm forgetting the name of the community, so hello. But you're talking
Detroit.
about a great way that you can, they added street art to corners near a school to slow traffic at critical intersections. And that becomes a community organizing, community mobilizing effort. They're putting up art. They may not even know that they're addressing a problem of speeding at that street corner. So there's a great way to be creative about how we put these environmental strategies in place.
Excellent.
Another great point I just want to read from Mitchell. Ask your city council or city attorney, can we assemble a committee to explore our current underage drinking policies and the enforcement in the past year? By simply asking about our current policies, perhaps someone in the community will decide to strengthen or update the policy. That's a great point. Ashley's does not want to sound like a negative Nancy, but we must be prepared to get a lot of no's before we get buy-in. And sometimes that's the case. And then sometimes you'll get a lot of yeses, depending on really the readiness of the community first to recognize the problem and then address the problem. But I think it's really important for us to understand as well that often part of our work involves framing the issue so that people who don't know about it actually can learn about the issue, which is why it's important that we gather data and assessment so we can tell the story with data to help people understand and recognize that there's a problem that needs to be addressed.
Dorothy, I love how you brought up the concept of framing. If you think about it, say if the local condition that you're addressing is that there's marijuana use in a park. Well, you could say, okay, the coalition wants to address the marijuana use in the park. But when we look at it through the frame of other people, what does the park department want? They don't like the litter that's occurring in the park because they have to clean it up that goes associated with that. So their frame is, well, there's littering and there's damage done to our park. The neighbors, their concern isn't necessarily the use, but it's about what happens after the parties in the park and people are leaving, what happens to their property. If you think about the families are concerned about, they don't feel safe going down to the park because there's these activities going on. So each partner that we bring into a local condition will have their view on it. That's our role, is to get that agreement to say, yes, from each of our frames, this is something that we can address. When they agree with it, what's going to happen is great. They're each going to play their role in addressing it. The Parks Department will help with the cleanup. The police will help with more enforcement. The neighbors will help with having the party welcome back to our park, et cetera. If they're part of understanding the problem, they'll be part of building that solution.
Love it.
If you do not ask, you will not get. Let's engage those partners. Thank you, Mitchell. Good. So the final piece here, just when we talk about, and there may be some other comments, just as we're talking about comprehensive strategies, another way of looking at being comprehensive is through the social ecological models, different ways, and there's different pictures of this. This particular model shows 4 different levels. It starts with the individual level. These are the youth or the adults. And then we want to impact them. So we're going to be providing information to them. Then we move out into a broader level of family and peers. We want to ensure that the families are supportive of healthy behaviors for their youth and peers are interacting in a healthy way. Then we can start impacting on, this all depends on what that local condition is, the broader ecosystem, things that immediately impact the youth and families, whether it's the school or the neighborhood or the media. And then the larger level is the laws and the norms and the culture of our community. We can impact that. So when you think about it, we can think about putting strategies in each of these areas of the social ecological model. And another way of looking at it, I'm generalizing here, we're generalizing here, that when we address those individuals and that microsystems, those will tend to be individual strategies. And that's great. We need those. But if we're going to impact the full socio-ecological model, we also need to impact those broader environmental systems that the youth and the families operate within. So this is just another frame. Again, different people will understand different aspects of this. They may get it with the flea story. Others will say, oh, I get it. We need to impact all levels of the socio-ecological model. So good. Great conversations and ideas. Thank you very much. And at this point, if I may, and if I can figure out where to find that stop sharing red dot is, I'm going to turn over to Dorothy, who's going to talk about an important aspect of doing individual environmental strategies, thinking about disparities. Take it away, Dorothy.
Love it. Thank you. Thank you, Dave. And so, as we're thinking about effective strategies, we spend a lot of time talking about the fact that we have to have basically enough dosage. We have to have enough individual strategies, and we need to have enough environmental strategies that we can actually change the problem behavior that we're addressing in our community. But it's also important for us to remember that there is a really important emphasis that we need to make on understanding disparities. So when we're thinking about disparities, just think about the fact that there are people that are vulnerable in our community, and they're vulnerable based on a number of factors. They're vulnerable based on maybe socioeconomic status, or vulnerable based on race, or vulnerable based on where they live. And so it's important for us to recognize, first of all, and then address, secondly, health disparities as we're looking at these community issues, because not everyone is impacted in the same way. There are some populations that are impacted at higher rates than others. So it's part of our role to really be cognizant of that. And what we're trying to do is achieve equity. In all of our work, we're trying to achieve equity, which really means that everyone has the right to quality health care, that everyone has access to prevention, treatment, and recovery services for both mental health and substance use disorders. And I love this graphic that's at the bottom of the screen. Is sometimes you think, well, we'll just give everyone the same. But the thing that's important to understand is not everybody's starting at the same place. See, in this first graphic, some people are way above other people in this graphic. If we give everybody the same thing, that's one thing, that's a step, but we're still not achieving equity. We need to make sure that we identify those vulnerable populations and give appropriate strategies and services so that everybody is at the same level. But where we ultimately want to achieve is that we remove barriers for everyone and we achieve true equality and justice. And so
you're inspiring me, Dorothy. This is great.
Yeah. And Dorothy, if I can add to your picture as well, I a phrase that I like to employ sometimes is while we all may be in the same river, we're not all in the same boat. And
love it.
Is that we have to be considerate of that, and part of what it is that you're helping us to think about are what does it mean for us to be thoughtful? What does it mean for us to be respectful? Because respect is a currency. And if we're I refer to it as the currency for change, and that's necessary for change, not just exchange, but change to occur. And so this really is about, even as we're thinking about these kinds of strategies, evidence-based, and all of that, how can we do that in a way that really matters on behalf of the communities that we serve?
Love it. And again, what we're looking for is not just to reduce the substance use, but we're trying to achieve equality. We're trying to achieve justice. And so when we're thinking about the lens of health disparities, yeah, I love it. I wrote that down. We're all in the same river, but we're not in the same boat. Words of Wisdom by Carlton Hall. And it's a beautiful.
I borrowed it from others that were wiser than I.
We all borrow. Right? I'm now borrowing that from Carlton. But there's so many different lenses that we can look through when we think about disparities that exist. And sometimes we jump right into, race and ethnic. That is one lens to look through for disparities, but there's also gender issues. There's geographic location, there's religion, there's socioeconomic status. There are so many lenses to look through when we look at those vulnerable populations. I can tell you in my home state of Wisconsin, we see that youth who identify as LGBTQ+ have much higher rates of substance use than youth who do not identify as such. And that's an example of a disparity, that's a population that is vulnerable for substance use in our community. So how do we find disparities? By looking at our data and by looking at our community. And so as we're thinking about environmental strategies, this is a really important point. We want to make sure that we change the behavior that we're looking to change, but that we also want to make sure that we spend some time thinking about what are those barriers or unintended consequences that may arise in the implementation of our strategies that will exacerbate the inequities for some of the underserved or underrepresented populations. So if we're not deliberate about looking through the lens of health equity, of identifying and addressing disparities, we actually may unintentionally widen those health disparities. So let's take a look at a couple of examples. In this one, their local condition, the problem that we're trying to change in our community is that retailers are selling to minors. So we know that an effective strategy might be to increase fines or to require responsible beverage server training. Now, Dave, there's a siren going off in my hotel room. I'm going to mute. Can you hear it?
No.
We can't hear
Okay,
it at all.
good. All right.
It's good.
It's really loud. I hope it's not a fire. I'm going to stay until I see flames. So,
Smoke. Start with smoke.
so if we increase the fines and we require responsible beverage server training, we may actually change that local condition of retailers selling to minors. But here, Dave, look what I see. I see a small one-stop sort of mom and pop shop, and then I see a sort of fancy, looks like a department store. Now, what could be some health disparities that might happen if we implement this increased fines and requiring responsible beverage server training, which also may require, outlaying the fees for responsible beverage server training, how that might result in an inequity in these two scenarios?
Are you asking me or you want to ask the group?
I'm asking both.
Okay. Well, we'll give folks a second. And think about, again, which where the agent, the host, and the environment, think about the communities and locations where these stores might be. And I'm just thinking the one-stop shop, it looks like this may be, we don't know where this is. And what we've heard stories where they have been in a very rural environment. And if that's the only store in that rural community that's also selling healthy foods like fruits and vegetables, and that store has to shut down or raise its prices, that's going to unfairly impact those people. So we want to think of ways that we can stop the behavior they did sell to minors, but also doesn't close that down, which is going to put a burden on people that live in the area. We've seen this also in the urban environments where there may be a healthy food, what they call desert, where they're not able to get it. If we close that store down, they're not going to, there's less food available. So we want to think about what is the consequences of what we're putting in place.
And all of the group is answering it. So love it. Emily said a mom and pop store might not have the money for that infrastructure improvement. And Anastasia said some may not be able to afford the training or have access to the training, financial stress. Shana said big retailers may be less likely to care about the fines. I love it. Or no time to get trained. Or maybe there's the mom and pop shop can't afford the same hourly wage. And so there's staff turnover and it's a financial burden for them to keep training the new staff. So what we want to do, Emily said, I like that idea of approaching from a restorative angle versus a punitive example. Exactly what we're saying is that we want to change the local condition. We don't want retailers selling to minors, but we want to implement those effective environmental strategies that's in a way that's not going to do harm. Love it. Here's another example is the local condition here is there's overprescribing of prescription medications. So one of the policy-based strategies is we might limit the number of days that prescriptions can be filled. What would be some ways that we might, that this might really impact populations in a negative way?
And just to be clear, this is a situation where they're limiting you can only have 3 days of these meds, and you have to come back after 3 days and get your prescriptions and to renew that prescription.
Takes a second while people are typing. Dorothy, what's the question again?
So what would be some of the disparities? This is Emily's got it. She's answered the question. If people are living in rural areas and they don't have transportation, it negatively affects them. That's right. So every 3 days, they're going to have to go back to the doctor. Some people may not have the time or the money to go back to the doc. Access to the pharmacy may not have means to travel, transportation. Exactly. We want to change the fact that there's overprescribing of medications, but we don't want to actually make it more difficult for people who have limitations in terms of socioeconomics or transportation to actually not be able to get the medications that they need. So when we're thinking about how we're addressing that local condition, we have to think about how can we do strategies that are not going to actually create more harm. So maybe a way to mitigate this would be, I don't know, Dave, maybe there could be, we could implement telemedicine so people would not have to actually go back into the medical clinic every 3 days to get their medications. Dana says it may cost more to get a few pills at a time instead of getting a 90-day supply of a 30-day supply. Also, if you don't have a local pharmacy, it makes it more difficult. So again, this is exactly what we're thinking about when we're thinking about effective environmental strategies. We want to make sure that we're doing things that are going to change those local conditions, the problems that we're working to address, without doing more harm.
Also, you don't know how long it took me to find a place where there were only 3 pharmacies in a large geographic area. So,
So we've talked about both individual and environmental strategies, and we've also talked about health equity. Why are these important when we're thinking about our work in prevention? Melissa's going to say in the dental field, dentists are offering different pain management strategies. Love it. Love it.
So again, why is it important to include both individual and environmental strategies when addressing your local conditions? Go ahead and put that in the chat.
As people are putting things in the chat, if people change their behavior, but the community doesn't support that behavior, then their changes aren't sustainable. That's a good point. Dana says, in McCormick, where I live, there is only one pharmacy and it closes early on Saturday. And the next is closest 30 minutes away. Ruth says, I love this.
Yeah.
It makes your problem turn into our problem. That is the root of collective impact.
and Ruth made a comment earlier, and I was trying to figure out the right way to bring it up when she talked about readiness. And part of readiness is building in, and we'll talk about this in just a second when we talk about the strategic prevention framework, is identifying what is the local condition. We talked about this, but bringing those people who are impacted by a strategy in as you're planning it so they can start to come up with these ideas, both on how it may create a burden and help to come up with some strategies. So that's about being ready and being inclusive as we're organizing to address these local conditions.
A couple other comments. Most effective when you interweave the two, there are force multipliers. Love it. Jen says comprehensive approach is critical as there are always multiple pieces to the puzzle. If that makes sense, it most certainly does. These issues are multifaceted and require a multifaceted approach. And Costella said a comprehensive action plan is critical if we actually want to see sustained change in our target communities. All really good comments, again, underscoring the importance of both individual and environmental strategies and understanding and looking through the lens of health equity. And with that, Dave, I'm going to stop sharing and I'm going to turn it over to you.
Great. Thank you, Dorothy. And so what we are going to do now, if I can figure out where I'm sharing here, and if I can move this over, okay, and I'm going to get my chat box going. Thank you for being patient. We are going to talk now about how we go ahead and build this comprehensive plan using our strategic prevention framework. And we've talked about this. Again, just summarizing, the strategic prevention framework is what SAMHSA, the Substance Abuse Mental Health Services Administration, has developed to guide all of its grantees in its efforts. There are lots of ways, lots of different versions of the SPF. They all talk about the same thing: assessment, capacity, planning, implementation, evaluation, doing that with the goal of being sustainable and as we've talked about, we need to be working toward cultural competence as we're doing this work, or have cultural humility as we're doing this work. So we're going to jump into doing that. And first we'd like to do is a little mental set, get us thinking about this and how we use the SPF to guide our work. And again, we've talked about rivers and German chocolate cakes. Now we're talking about cars. If you're going to buy a car, what would you need to do? What would you do as you're going about making this big purchase of buying a car? You know, a car isn't necessarily an impulse item we pick up as we're standing in line at the checkout counter. We want to do our research. And Kimberly, if I could ask you to say, what kind of research do we want to do? We want to check, right, the cost, the safety ratings, the gas mileage. We want to look at our own, check the finances. How much money do we have to buy it? The miles per gallon, that's the kind of research. What is my budget? Exactly. Auto safety, motor, etc. Cost. Service requirements, right? How much service does it take? What are they going to provide in terms of their maintenance agreements? Exactly. And where would you go? Assess the individual. What do we need the car for? Am an individual and I'm living by myself and I want a Sportster, or I've got a family and I need to drive 5 children around? Watch tours to make it sure it fits your family. Watch tours and again, try it out. Take it for a test drive. How it makes me feel. Does it improve my sense of well-being? These are all excellent descriptions of all the consideration that goes into buying car. And what you've just identified is the strategic prevention framework. You talked about doing an assessment. How are we going to use the car? What do we need it for? What are my criteria for buying a car? Then you've talked about capacity. How much money do we have? What do we need the car? Is it going to be parked on the street? So that's looking at capacity. We then want to look at planning. How are we going to use the car? And here's where we do the research. Now you can go online and you can get all sorts of information. You can go to Consumer Digest. There's lots of information we can find out about each car that we're thinking to buy. Then we implement and we actually buy the car. And cars have warranties and you can return it after 30 days if it doesn't meet your needs. That's the evaluation. Is this car meeting my needs? And again, when we think about cultural competence, does a car meet my needs, how I want to use it, that meets my personality? I think that was Carlton, how it makes me feel. Is it making you feel right? Is it fitting into your personal culture and your community culture? And finally, sustainability, is this car going to last? And so again, we have just done, and as we walk through the strategic prevention framework, and I'm thinking again, as preventionists, as you're sharing why we need to use a process with the community, you can use buying cars. You can use, we need to bake a German chocolate cake. You can use the strategic prevention framework for anything. We're going on our family vacation. We can use the strategic prevention framework because it's really looking at what is it we need to assess? What is it we want to do? Let's find out what the issues are, what our needs are. Do we have the capacity to do it? What capacity do we need, et cetera, as we walk through all this. And so we've talked about how important doing the community assessment is to coming up with what individual and environmental strategies we're going to put in place. What we're going to walk through is an abbreviated example of using the SPF to strategic prevention framework to select strategies. And we're going to start with, and this is a form of a logic model. We haven't used that word yet. I think this may be a new record, an hour 12 into a training. We haven't used logic models. This is an abbreviated version, but we've done an assessment where we define the problem that, the underage drinking, 17% of 10th graders that use alcohol on a regular basis, almost a majority, say it's pretty easy to get. So we're starting to narrow down our issue in terms of alcohol and underage drinking and availability. Then we find out that it is retail availability, that the retailers are selling to minors. 38% of retailers failed compliance checks. And again, those 10th graders are reporting, over a third reporting they actually buy their alcohol from the retailer. So we know what that condition is. And if you think about it, that's where the agent, the host, and the environment come together. Again, in this case, it's at the liquor store where they're not carding or they're not checking IDs. And so here, now we can start to identify our strategies, but I'm going to ask the chat box before I show what strategies, what might be some other questions that we ask? And you've touched upon it in our previous discussions, but when we start to identify retail availability, what else, what are the more detailed questions do we want to know about that situation where the agent, the host, and the environment coming together about it, about, again, at a retail location? What are some other details that we would want to know? Anybody?
It just takes a second.
Yeah, put it in the chat box, folks. You're talking about this example that you have on the screen now, right?
Exactly. So if you're thinking about, someone's mentioned it, is do they have the ability to do training? Again, if it's a small retailer, and if we're going to require responsible beverage server training, do they have the ability to provide their training? What might be some other factors that we look at as we're developing strategies for the situation, this local condition where retailers are selling to minors?
One of the things that I think of, Dave, as folks are thinking about the chat box in many rural communities, retail compliance checks, sometimes that's an undue burden on law enforcement because they don't have the resources to actually implement the compliance checks. We want to look at whether or not the retailers, what their capacity is to actually enforce compliance checks.
Yeah, or who the enforcement agency is. Is it the local police? Is it the local sheriff? Is it the alcohol beverage control of the, so who has jurisdiction? Who do we need to bring the table? I don't know who SLED is, but SLED does a compliance check. So again, what is SLED's capacity? If we're going to recommend more compliance checks and they don't have the capacity, then that's not going to be an effective strategy. Excellent, excellent. Other considerations. How many retail stores in the community? Again, if you're an urban community, there may be hundreds of retail stores. Do we really have the capacity, if we're going to do more compliance checks, to do that many? Or if we're going to provide responsible beverage server training, can we do it to 100 different stores in the community? That's a little bit different than if we're a smaller community with only 5 retail stores.
And Dana said add harsher penalties for those who sell. And so thinking through that lens, we definitely want to have consequences. How can we implement penalties that are not going to add undue financial burden to retailers that are trying to do the right thing, but that are still acting as a deterrent in changing that local condition?
And along with those penalties, we want to know who has jurisdiction over changing. Is it a city ordinance? Is it county? Is it a state ordinance of who has the ability to change that? And also, who's responsible? And I know in some communities you can hold the clerk responsible and the owner of the store isn't held accountable. In others, the owner's held and the clerks aren't accountable. Those are all different considerations. Again, we need to do a check to find out. Thank you, Xavier. Hello, X. How do we, the retail owners feel? What is it? You know, some retail store owners, they're really pro prevention, meaning we don't want to sell, but some of their clerks, they don't have control over, they're selling to their friends or they're selling. So we want to find out what that situation looks like. Exactly.
I love what Kristen said. It's so important to know who can give you the yes, and then who would be the enforcing entity to promote compliance.
Right, and Dana's saying the clerk gets a ticket, the license holder gets a ticket, and the clerk is required to go through merchant education. So again, and what's the situation? Are convenience stores having trouble hiring people? Is that going to be an issue as in hiring and training and require them to go through these trainings? These are all valid considerations as we're doing that assessment. And again, let's start to think, where is the alcohol being consumed after the purchase? That's part of our considerations. Do we need to have more strategies to address those situations? And that may, Melissa, that may even identify new local conditions. Well, mostly the kids are getting it and they're going to the park across the street and that's where they're drinking. That may be 2 separate local conditions. I love it. I love it. Right. So we can make sure the license holder is accountable because they're going to be responsible for what their clerks do. Excellent. These are all the considerations that we want to go through as we're developing our strategies. And you've identified the ones that we did. Again, public education, let's make the public aware of the situation. Compliance checks, responsible beverage serving. You can change policy if you're able to require that they demonstrate they've had the responsible beverage server training each time they have to renew their alcohol license. So there's a lot of tools we have once we know what that local condition looks like. And so as we're developing the comprehensive strategies, we do have some guides to say what is it that goes into a given set of comprehensive strategies. One guide is from SANSA and CSAP, the Center for Substance Abuse Prevention. And a lot of funders use this, the states use this for reporting their block grants, but they've identified 6 different categories of strategies. So again, when we look at these categories and we're developing, I'm going to go back, comprehensive strategies to address a local condition, we can consider each of these. What are environmental strategies we can put in place? Are there any community-based processes? Do we have a coalition? Do we need to do the community organizing before we address this local condition? Ruth mentioned, let's do a strategy where we're going to do a community event, paint the street, or put up art projects to build that sense of community before we go out and address this more serious local condition that we've identified. Information dissemination, that's getting the word out. How do we do that? Problem identification, referral, that's more that individual strategy where once we identify people who are downstream, if you look at that river analogy, how we make sure that they get assessed and they get the referral for treatment that they may need. Education strategies are, information is one-way communication. Education strategies is 2 ways, where we're working with individuals and providing skills and an opportunity to practice those skills. Then alternative strategies are things that, again, given the local condition, if say if the youth are drinking after the football game, some communities have put in place a fifth quarter, which is an alcohol-free place where youth can go after a football game, and it's a safe environment to have a party and celebrate with the team. So the point is, we want to consider all of these strategies as we're addressing a comprehensive set of strategies to address a local condition. Any questions or anybody want to add anything about these strategies? Again, these are a guide, a way of looking at how we can be comprehensive.
Love Ruth's point. People not trained in the SPF tend to offer information dissemination and alternative strategies and then wonder why they aren't seeing change. It has to do with working at multiple levels.
And so just as we looked at the SAMHSA CSAP categories of strategies, another way, and those of you that may be drug-free community grantees or have attended some CADCA trainings and are working with the Office of National Drug Control Policy, I think I've covered all my acronyms. CADCA is the Community Anti-Drug Coalitions of America, is they provide a very similar 7 strategies, and it tends, the way the strategies tend to play out, providing information, skills, providing support. It may be that we have the ability to provide the training, we just don't have locations. The role of a coalition could be to provide the venue where the training occurs. That may be simple, or to get the funding so they can do responsible beverage server training at the retail locations themselves. Those are more individual strategies where we're supporting and make sure that people have the information they need. The environmental strategies, as you can see, are changing that environment, whether it's putting up a speed bump or putting up lighting in the park or putting up, again, here's where changing the consequences. We've talked about fines. Where it's appropriate, they can be positive consequences. A lot of coalitions reward those retailers who do pass compliance checks, and they put a star in their window and they recognize them. Let's look at what we can do to change the consequences from, again, the way we look at this is keeping people from doing what we don't want and reinforcing people to do what we want them to do. Change of physical design, we saw that clearly with the methamphetamine when that was big, when they moved all the cough syrup behind the counter. We saw that with tobacco. They put tobacco behind the counter. We love to see alcohol put off in places where you need an ID to get into that location. And then finally modifying those policies. And we know it's more than policies. There's big P's, little P's. It's those procedures, those practices. So again, we can look at the 7 strategies that are both individual and environmental and look to see that when we consider all those, we can have a chance of being more effective at changing the behaviors we want, period.
Dave, just one added comment to this is that a lot of this work is built on the science that was done by the University of Kansas and the Community Toolbox. And so there is another source and resource that you will be able to utilize in order to be able to get access to this information. This is really, really wonderful work that's been promoted by ONDCP, DAF, and drug-free communities, as well as CADCA. But the science was based upon great work that was done by scientists at the University of Kansas.
And Ruth is making an excellent point here. People not trained in the SPEF or in comprehensive strategies tend to deal with information dissemination, alternative strategies. In some sense, this is not diminishing them. They're easier to do. It's easy to put up a sign. Again, it's a lot easier to put up a sign than it is to put a new ordinance into place. So again, that's a good start. Let's start with those easier activities, and then we can build toward the comprehensive individual and environmental strategies that we know it takes to change the local condition. So again, Ruth is talking about readiness. Let's provide that information. Let's build people's readiness to move on to the more, I'll say, challenging strategies.
The other thing I want to say that really
Yeah, I forget-
underscores Ruth's point is people not trained in the SPIF may or may not be providing the right information and the right alternative strategies. Because if folks really need to also clarify the local condition, and that is done by conducting a community assessment. So Ruth, there's a whole lot of wisdom in what you just commented there. We want to get to the environmental strategies. We also want to clarify what the problem is before we jump into strategies, so that what we're doing is actually going to be the right thing in our community to create behavior change.
And I forget who it was that is forming a coalition. They've got their county commissioner and the police department. That may be a lot easier to get policy passed when you have those people on your committee. So when we start thinking about organizing, who are the right people that we're going to need to put these sorts of strategies into place? Excellent. So let's just look at some example here for our retail store selling to minors. It's the same strategies, but when we look at it through the lens of the 7 strategies, you can see how we are being comprehensive. And if you can read this, provide information to store owners, provide the training to the clerks so that they can learn how to check an ID, they can spot a fake ID, they can use the point of sale system, whatever the store has in place. Providing those point of sale systems. In one case, again, Dorothy and I did a lot of work in North Dakota. They were buying scanners for bars so they could easily scan the IDs, and then that took the guesswork for the bouncers out of checking IDs. So it was a great way of, again, making it easier for someone to do their job. We can start talking about providing barriers, the point of sale at the cash register where they have to show their ID or insert the ID into a situation, into a machine, change the consequences, put up signage, we card, and then obviously modify the policy. So again, we've talked about all these. What's nice about this, it's a systematic way to make sure we're going to be effective at changing this particular local condition. And just 2 ways, just as you're doing this, 2 ways to think about this. One, we can start at the top and go down and do all these things. Then it's a nice practice to say, whatever policy we're putting into place, let's make sure we're going to be supportive of that policy. And let's start with the bottom with the policy and then work our way up. And it's good doing a top down, bottom up is a great way to make sure we're going to be comprehensive in looking at these strategies. And just Dorothy had us thinking about health equity as we go through this. And so just some considerations. And are those, and we've talked about this, are those who are affected by the issues, are they involved with us? The last thing we want to do is put an issue into place and then find out that it's causing some harm in the community. Let's identify who are people that 2 things, one, that can impact it, who have resource to impact it, but also who is impacted by an issue, make sure they're at the table with us. We want to make sure that it does improve conditions and it doesn't cause harm. That's, again, the only way we're going to find that out is by talking to people, identify if there are any barriers with these intended communities, and then finally make sure that it's going to be equally enforced across the community. And this is important. Why it's important to have law enforcement and community members involved so we can make sure that that enforcement is fair and appropriate across the entire community. So again, this is, and we, in the resource guide that Kristen mentioned will be sent out to you or available to you, the CDC has a great website that literally walks through each element of the strategic prevention framework and provides those considerations for what we can do to ensure health equity at each stage of the strategic prevention framework. These questions are from that CDC guide, Center for Disease Control. So just looking at one more example, we can't provide too many examples here, is if our problem is prescription drug misuse, and we find out that, again, prescription drug use is high among high school students, and we have the availability, they're saying it's easy to get, and the adults even think it's easy for youth to get these. When we look at our local condition, is that teens who are prescribed, again, this is very detailed, but student athletes who are prescribed prescription medication, painkillers for their injury are then sharing that with their friends. And we have some evidence of that, both quantitative and qualitative data. So before we show the strategies, well, actually, we have a slide here. These are some evidence-based strategies that have been shown to be effective in general at addressing the prescription drug. We can provide presentations to those prescribers. We can look at the prescription drug monitoring system to find out who's getting what drugs, who's prescribing the drugs. We can do media campaigns, school curriculums. There's a lot of things we can do. And Dorothy in a minute is going to be talking about the evidence-based strategies. These are some of those. But I'm going to ask you all, if this is our local condition that teens are prescribing prescription drugs, what are some individual and environmental strategies that we can put in place, knowing that it's happening at school with those student athletes? What are some of those individual and environmental strategies? And if you can, this is just to take us to the next level, as you put your suggestion in, put whether you think it's individual or it's environmental, if you so choose.
Jen's already done so. She said individual strategy is to provide education.
I love it. And then my question was going to be, Jen, who to provide the training to? And Charlotte's talking about it's the coaches. They're in one of the best positions to monitor their athletes who are injured, and they want to see the athletes recover because they're going to help the team. Education, it's education not only to coaches, to the youth. I'm going to provide education to parents because they're going to be providing the monitoring of the prescription drugs. The school nurse education may be the one providing the education.
Yeah, Jen says coaches, parents, teachers, and the kids. Emily says environmental controlled substances that need to be taken at school need to be in the nurse's office or the trainer's office with a log and stored there. Love it. Love it.
Yes.
May or may not require a policy change to do that.
Task teachers to incorporate drug prevention into their curriculum. Anastasia said, Jen said, that's a great idea, Emily. Ruth said, to Tara bag distribution, clear expectations of pain management, physical therapy before surgery. Love it.
The Terra bags are a great way of disposing of prescription drugs when they're not needed anymore. I love it. Thank you. Again, if it's warranted, people always ask about drug testing. If that's, let's find out if these athletes let's test them to see how much they're using the drugs and if they're misusing the drugs. And again, there are fair and appropriate ways to be doing drug testing that is fair to all students. So great, we've seen some individual and we've seen some environmental strategies to be able to address this situation. And it also goes back to, someone mentioned pain management, but it's the training of the prescribers. In some cases, I've seen where youth will get 30 prescription painkillers when they have their wisdom teeth out. Do they really need the 30-day supply of those or 30 painkillers? What's the right number of painkillers? Let's be thoughtful about those situations.
And Dave, I think it's important to be honest about kind of where we are with these strategies at now. The fact of the matter is, I think it's harder sometimes for us to think about environmental strategies than it is for us to think about individual-based strategies. And if that's the case, know that and it's okay. And so when we work with, it's one of the reasons why working within the context of a coalition is so very, very helpful and so very, very important, because you need more than just one organization or one person to be thinking about these things. And so it's okay that environmental strategies might be a little more difficult to come up with, but recognize that when we do identify them, we're actually finding those strategies are much more cost effective, cost efficient, much more pragmatic and practical. And so it may take a little bit of thought because we don't have that kind of skill developed or practice developed, but the more we practice it, the easier it becomes.
And Carlton, I love how you talked about being thoughtful about it. And we can also talk about implementing these environmental strategies in stages. I know some communities, when it comes to doing responsible beverage server training, they've asked for voluntary compliance and get their stores. So let's start with those retailers who want to get their clerks trained, who are volunteering for it. And we don't need a policy, a new ordinance to do that. So if we can get 3 or 4 retailers to voluntarily do it, then when we go to put the ordinance in place, we can say, hey, these retailers did it with no burden. They may even come to support the ordinance so that everybody will be doing it. So again, that's the whole point of let's be thoughtful about how we're applying these environmental strategies.
Excellent, excellent.
And so this is our knowledge check at the end of this. If you can put in the chat box, which of these A, B, C, D, or E, adopt a team policy, implement an education or awareness campaign within a school district, reinstate Friday morning classes to shorten the elongated weekend, restrict alcohol policy on public property, hang posters that warn of the dangers. Which ones of these A, B, C, or D are environmental focused strategies? And while you're doing that, you may have a question about C, reinstate or maintain Friday practices. Friday classes, this is on a school campus, this is looking at a college environment, is what the research has shown that has decreased the amount of partying on Thursday night when students have to get up and there are classes and even tests on that next day. So that's would be an environmental strategy addressing that local condition of the Thursday night parties on a college campus. So I'm thinking.
All right, which of these are environmentally focused strategies? A, B, C, D, or A? We're looking for them in the chat.
Oh,
I'm gonna do the Jeopardy theme song here. Do 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 do. All right.
I think people are catching on, all of the above, and I think Dana skipped the informational ones. They all are potentially environmental strategies. So thank you all for considering that. And with that, I am going to have found my red button, turn it over to Dorothy, who's going to bring us home talking about what did we know about evidence-based environmental strategies.
Love it. Thank you, Dave. And so I love that Dave just took us through how we identify and clarify those local conditions so that when we're jumping into strategies in our community, that we're doing the right strategies that match the problem that exists in our community. And so it's with that in mind, when we've, like Ruth said, implemented the strategic prevention framework, so we know the what and the why of what's happening in our community. When we're looking at strategies, there are a lot of evidence-based strategies that we can look at. Evidence-based is one of the most overused terms, I think, and sometimes people are creating their own definition of what is evidence-based. Dave and I were just talking about that earlier this week. But evidence-based environmental strategies have been selected based on a lot of research. And so there's research design, there's internal validity, independent replication, and then there's also external and ecological validity. And so there's lots of resources from SAMHSA on selecting evidence-based programs.
And Dorothy, as you're saying that, what's nice about that is when you're selecting evidence-based strategies, you can ask the developers or do the research just like you did with your car, is to find out, has this evidence-based strategy been tested in my community? I may be a rural community or a specific population lives in my community. Has the strategy been tested in a similar community? That'll give you more confidence that, yes, this will work in my community. So that's why that research base is so helpful in us deciding what the strategies are.
Yeah, love it. And there's lots of places that we can find evidence-based environmental strategies. So SAMHSA, Substance Abuse Mental Health Services Administration, the Centers for Disease Control, the National Institute on Drug Abuse, just a few places where we can find evidence-based environmental strategies. States often have guidance documents as well as other organizations, and good old Google. I've been working with in training rooms where people can't find an evidence-based strategy on a registry, and you know what? They did a Google search and found levels of evidence for specific strategies that were addressing the problem in their community. So once you identified and clarified that problem in your community, there's lots of resources to which you can turn to identify what has an evidence base to it.
And just one other point, as Dorothy goes through these, all of these that she's sharing are listed in that resource guide that'll be handed out after this training.
It's important for us to make sure that we look at the criteria for the evidence base. Don't assume that all of the strategies are based on good research. So there's different levels of evidence as we're looking at effective strategies. But here's just some examples of, there's lots of evidence-based strategies that you can implement if you're trying to reduce initiation of use among youth. Smoke-free policies can lead to reduced initiation of tobacco use. And then there's all these evidence-based strategies that can help reduce access to tobacco, from community education to active enforcement of sales, to community mobilization, to laws directed at minors' purchase, possession, or use of tobacco products. This is from the CDC.
I'm sorry.
Looking at marijuana, there's also a lot of evidence-based or promising programs. And Dave, that's a really important point, to recognize that sometimes with emerging issues, we don't have strategies that are considered to be evidence-based, but they may be promising, which means that they have gone through some research and there's been some evaluation and that they're shown to have positive results, but they haven't quite met the standard of evidence-based, but that they're also, especially when you're addressing some emerging issues in your community, can be very effective at addressing local conditions.
And Dorothy, a good example of that is it happened in Washington State. We know that with alcohol and tobacco, if we raise the price of alcohol and tobacco, what happens? Consumption goes down.
Yeah.
So the alcohol policy, their mantra is raising taxes saves lives. But when marijuana was legalized in Washington, they said, okay, we'll put a really hefty tax on marijuana. That'll keep consumption down. But what happened was, if you're buying marijuana, would you go to a legal retail store and pay more for it than you could get it from the source of marijuana that you've been getting it from all along? They found that raising the price didn't affect marijuana because there's an active black market or gray market in marijuana. So again, that's why you don't see here raising the price of marijuana as one of the evidence-based strategies.
Love it. You know, the other thing I want to say about evidence-based strategies and emerging issues, and so I'll say it here while we're looking at marijuana, is sometimes there's emerging issues. Like in many states, there's problems with Delta 8, which is a sort of, it's a gray area whether or not it's legal to sell Delta 8, but there's a lot of states that are selling Delta 8. Well, there's not a lot of evidence out there, but we know that things like reducing outlet density is going to reduce or restrict access to youth. So in many of the states where I'm working, communities are working on trying to proactively restrict outlets that sell Delta 8, using the evidence of underage drinking and understanding that outlet density reduces underage drinking. So it's really important to understand that there's lots of ways that we can look at evidence-based strategies and incorporate them when we're addressing the issues that we're working at in our community. Now, when we're thinking about underage drinking, we've got a lot of research on the risk factors. We've got a lot of research and evidence on effective strategies. There are a lot of effective strategies that can reduce risk, like access and community norms that condone or promote the use of alcohol, but also increase protective factors, which are those factors that are going to act as buffers or going to mitigate the risks that exist in the environment.
What this points out to me is we need to know our local conditions, because we go in and say, we want to address underage drinking. There's probably 100 strategies we could use. When we know our local conditions, when we know what risk protective factor that falls under, then we can narrow our search down. I'm going to go, Carlton, when we started doing this, how many years ago? I think there were 8 promising practices when we first started back in the 90s. Now we have 100, and there's too many to choose from. When we have those local conditions, then we can target our search.
Well, clearly you gentlemen are a lot older than me, I'm just going to say, because there's a lot more than 8 now.
I knew that was coming next.
The other thing I want to say about effective strategies, and I'm going to say it, we're talking about underage drinking, is Dave said it, we said it, we're going to say it one more time for those of you in the back of the room. You know what? It has to match the problem in your community. I moved into a new community in Marshfield, Wisconsin in 2006, and a community close by had just implemented a keg registration ordinance. It was extremely effective in that community. So I started thinking about, let's do a keg registration in our community. Guess what though, Dave?
I bet they don't use kegs in your community.
Nobody sold kegs in my community. So it was a fantastic evidence-based environmental strategy that didn't fit the local condition in my community. And I think sometimes that's a risk with evidence-based strategies. We don't want to just jump into knowing what strategies work without matching it with the data to what's actually happening in our community. So when we're looking at evidence-based programs and initiative for prescription drugs, there's actually a decision support tool that provides a description of 33 evidence-based elements. I also want to say too that when it comes to prescription medications or prescription drugs, many states have produced reports of recommendations that have been convened by groups of experts. I actually chaired one in Wisconsin. So there may actually be, in addition to some of the national registries, there actually may be a state level book of recommendations in your state that actually has some effective strategies that have been identified within your specific state. So this is just showing that there's a lot more than 8 evidence-based strategies now. There are a lot for alcohol misuse. We're seeing more and more with marijuana misuse. And more are really coming online every day. We're seeing evidence-based programs and approaches for illicit drug use, for other substance misuse. And so the point of this is that no matter what the issue is that you're working on in your community, once you've clarified with data that local condition, that behavior they're trying to change, there are all sorts of resources that can guide you to evidence-based strategies that will help create behavior change in the community.
The beauty of this slide, and thanks to SAMHSA, is they're starting to do now for specific populations. This is looking at young adults, and this is that hard to reach group of those 18 to 25-year-olds. And they've done even research on what is effective for them. So there's now coming for different populations, evidence-based strategies that we know work with populations. This just shows all that's available for that 18 to 25-year-old.
And when we're looking at opioid overdose prevention, now again, that is a little bit further. These are for the folks that are already in the river, to go back to our river diagram. But there is all sorts of evidence-based strategies. There's naloxone, there's medication-assisted treatment or medication for opioid use disorder. There's academic detail. There's all sorts of strategies that we know that can be impactful and effective in reducing the burden of overdose at the community level. Also important to understand that we know what doesn't work. Scare tactics do not work. One-time assemblies and events, those one-shot deals, they are not going to be effective long-term. Mock car crashes, myth busting, there's all sorts of strategies that we know don't work. So we want to be cognizant of telling you what we know does work, but also recognizing that there's a lot of strategies out there that actually not only don't work, but can actually do more harm. That grouping at-risk youth together, one of my school districts I worked with did that, and what happened was they had a really good diversion program, but they grouped all the at-risk students together, and what happened was they didn't see reductions in substance use. They actually saw increases within that particular group because of just the way they approached the initiative. So we want to make sure that we're also cognizant of the fact that there are strategies that absolutely are not effective.
Can I make a point about this?
Please.
There are some communities where, again, the mock car crashes is an example. They've been doing this for years. The law enforcement gets involved, the community gets involved, and we know that that may cause further harm. It may cause trauma for those that have experienced a crash and are traumatized by the experience. The point is, we don't want to necessarily stop that because there's a lot of community organization and community mobilization going on around it. But let's make sure we're surrounding that with evidence-based comprehensive strategies. So there's a lot of the curriculums going on, a lot of environmental strategies going on that around this. So we are, again, Dorothy's talked about dosage. There's a lot of dosage that will, in my language, not SAMHSA's language, offset the impact of the mock car crash.
Yeah, that's a really good example. Like Dave knows, I was the state executive director for Mothers Against Drunk Driving years ago for one of the states, and we had 13 chapters throughout the state. Many of those groups spent a lot of their time actually building mock car crashes annually. And so we were trying to keep them at the table, keep them engaged and involved, but sort of steer them away from the mock car crash. If we'd come in and just said, mock car crashes don't work, guess what would happen, Dave? I would have lost all 13 chapters.
That's
so
right.
it was a process of doing the marked car crash, but also trying to give them some, skills development so that they recognize that it was a point in time, maybe around graduation. It might change behaviors in the immediate term, but if we really want to have long, impactful strategies, that we need to veer away from what we know doesn't work. But that's an important point. We don't want to go into communities, see something that people have been doing and are really committed to doing, and tell them it's wrong and expect them to stay at the table.
And Ruth is asking about, there's some campaigns put out that may not, they're free, so it's easy to get, but they may not be the most effective. And this is where I'm going to recommend contact us, CADCA has good technical support. SAMHSA has a lot, and SAMHSA is putting out a lot of infographics now that relate to specific topics. So there's a lot of free information that's being provided. The Center for Disease Control puts out. So I would encourage you to provide those coalition development support or technical assistance from these organizations. And again, we could, on the resource list that we're providing is access to all these resources that we've been talking about.
Love it.
And just to underscore that point, please reach out to the PTTC.
Yes.
And they are able to connect you with all of the various resources that not only are mentioned today, but be able to start to address some of the questions that you might have. Absolutely.
So we just went through quickly where you can find evidence-based strategies. Why is it important to refer to evidence-based strategies when we're developing comprehensive strategies to address local conditions? And I think we've been answering this all the way through, but I'd be really interested in hearing any comments in the chat box on why it's important to refer to these evidence-based strategies when we're looking at addressing local conditions. And actually, I'm going to stop sharing because we don't need to stare at that question.
Yeah.
And yeah.
Again, part of it is Kate answered that before we even asked it. Adopt an environmental strategy of do no harm. Let's make sure, again, when we use evidence-based, they've been researched and identified as doing no harm in their community. So thank you for that, Kate.
And if I could pick up the baton here, Dorothy, what I'd like to do is use the remainder of our time, just a bit of it. I'm going to bring up Taylor in just a moment, or Kristen in just a moment to finish up. But I really am interested in a couple of things. One, I'm interested if you have any questions. There was a lot of information that has just been presented. You guys got a lot. Kristen is just saying, mind blown. I got it. So do me a favor. I'm going to do this. I want you, if you have a question or a comment, please, at the bottom of your screen, you can raise your hand. I'm going to do so. I'm going to just do just that. If you raise your hand, we're going to be able to unmute you just to ask your question or provide your comment. And others, if you wouldn't mind, please, I'm interested in one idea, just one big idea that you may have gotten throughout everything that we shared today. If you might be able to put that in the chat. If you got something from this training today that that was something that I'm going to take forward, please put that idea in the chat. And if you do that, please offer that. Again, if you have a question or a comment that you'd like to speak, raise your hand and we'll go ahead and unmute you. While we're waiting for you guys to do all of that, I really want to acknowledge, I saw a few friends that came on. I didn't realize that they were here in the room, but I did want to acknowledge definitely Samantha, I see you and I thank you. Hey, what's up? Hope everybody in Kentucky are well. Please give our love and our hearts and our thoughts to our great folks in Kentucky that are really going through some hardship right now. Costello Green, I saw here, and she was actually providing some responses. Costello was a remarkable leader for our field at the Substance Abuse and Mental Health Services Administration, and really helped support. Her passion and her conviction was remarkable, and really helping to push the prevention field forward. And so we're honored to have you, Costello. Welcome. It's great to see you here and in the mix. Any thoughts, any questions? Anybody raised their hand yet? Kristen, do you see anything?
I haven't. Taylor, I don't know if you've seen anyone. Can you guys raise your hands? But you can put that in the chat. If you're unable to do that, you could also put in the chat, unmute me, and Taylor
I
will find you and unmute you.
Yeah, and but I'm seeing some
Yeah.
wonderful folks ideas that they have. I really like the idea of going back and rewarding stores after alcohol or tobacco compliance checks if they did not sell. It would be good to give them
Mhm.
positive recognition in some way. Adopt an environmental strategy that does no harm. So implementation can be more successful and centered with that community. Excellent, excellent, excellent.
You
Uh,
know, that positive recognition is a really good point, and it's not just, maybe giving a certificate to the store or to the clerk and the owner saying great job, but also using your media and maybe working with the media to write up a story on the stores that are doing well. It also serves to remind the community that this policy is on the books, and they can help enforce it as well, not just the store clerk or the store owner.
Kimberly's offering many of the points of views have helped me see things from a holistic perspective. I also found education in the chat box, just hearing from other people. Thank you. Today, Mindy said she was reminded of how important it is to do a community assessment during around health disparities. Fantastic, fantastic, fantastic. Thank you, thank you, thank you all. And from my seat, a huge thank you to Dave and Dorothy for leading this conversation as effectively and efficiently as you have. Thank you for being great partners in the development of this course. I appreciate you and Dave and Dorothy. I'm gonna start with Dorothy. Any last thoughts by you, and then to Dave, and then we're going to turn it over to, I believe, is it Kristen or Taylor? Who are we going to turn it to? I'm gonna do it, Taylor. All right.
All right. I'm going to make one comment and then I am going to say goodbye, but I just my comment is thank you. Dave and Carlton and I put these sessions together and they don't come to life unless and until participants actually engage, and you all engage in a meaningful way from the very beginning to the very end. So you have warmed this trainer's heart. It was a great discussion and I really just enjoyed our time together. So with that, I'm going to say thank you and I'm going to say I'll turn it over to Dave.
Thank you, Dorothy. Have fun in the training you're at now. So thank you. And ditto. Thank you all for staying with it. One of our gauges is how many people stay with the training, and all of you stayed with us. So thank you very much for investing 2 hours of your time in this important topic.
Don't go away. Final instructions by Taylor. Dave, thank you so much.
Thank you, Carlton. So when you exit this webinar, you will be redirected to another site. Don't be scared. It'll say it's directing you to an external site. It's to take our evaluation, and then please do so. That's how we know whether we're doing a good job, which ways we need to improve. And then once you answer those questions, there may be a couple additional questions, and then you will have it download your certificate of completion for this webinar. So make sure you get that. We thank you so much for attending. You guys are awesome. And have a great rest of your afternoon.
Don't forget to check out our YouTube page, and the slides and resources are going to be on our website in, I bet, a few hours because our marketing team is quick.
They're on it.
Perfect, perfect. Thank you all so very, very much. See you all next time, September 12th. Be there, be square. It's going to be fantastic.
Bye, everybody.
Bye-bye. Dave, I sent you an email.